Hey. Good afternoon, everyone. We're going to call this meeting of Health and Human Services Subcommittee to order. Today we have 4 readouts from respective agencies, and we're going to call up Ms. Victoria Martinez to have the MDH Office of Healthcare Quality read out.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'll be presenting the Office of Healthcare Quality Analysis. The Office of Healthcare Quality licenses and certifies several types of healthcare programs and facilities for compliance with state and federal health safety and quality of care standards. As you can see on the cover page, the fiscal 2026 allowance increases by $2.2 million, or 5.4%, for a total of $41.9 million. Moving on to the next page in the fiscal 2025 section, Section 21 of the fiscal 2025 budget bill adds $103,000 in general funds and 1 regular position for an additional health facility surveyor nurse in the long-term care unit, and DLS has asked the agency to comment on whether the added position has been filled. Moving on to the agency spending, Exhibit 1 on page 3 shows the agency spending for the fiscal 2026 allowance. About 83% of the agency's allowance supports personnel, but there's also a $4.4 million contract for nursing home subcontractors and grants. Exhibit 2 on the next page shows personnel spending by monitoring unit, with the largest portions being in the long-term care unit and the developmental disabilities unit. Moving on to Exhibit 3 on page 5, this shows a breakdown of the $2.2 million increase. The largest increases are for personnel expenses, with smaller changes in expenses relating to nurse surveyor positions and administrative changes. In terms of personnel that's shown on page 6, there's no change in regular or contractual positions in fiscal 2026. Exhibit 4 shows the vacant positions by program and position type. The agency has made improvements in filling vacancies with the current vacancy rate of 5% compared to 17% last year. Moving on to the key observations. The first key observation on page 8 discusses the office's mandated survey activities and progress in meeting their goal of surveying all providers annually. Exhibit 5 on page 9 shows the annual survey rates in the developmental disabilities unit, and Exhibit 6 on the next page shows the same thing but for the assisted living unit. From fiscal 2023 to 2024, both units showed significant improvements in meeting their annual survey mandate. Exhibit 7 on page 11 shows the long-term care unit survey activities, showing some improvement in 2024, but since only 21% of facilities received an annual survey, DLS has asked the agency to provide the average and maximum time elapsed between surveys in fiscal 2024 and 2025. The next key observation on page 12 discusses improvements in resolving the long-term care program complaint investigations backlog. Exhibit 8 on page 12 also shows the number of complaint investigations received and completed. The percentage of completed investigations has shown improvement, almost doubling from fiscal 2022 to 2024. The agency completes these investigations based on CMS guidelines for prioritizing complaints based on the risk to a participant's health and safety. These priority levels are summarized in Exhibit 9 on page 13. And then Exhibit 10 on the next page shows the investigations completed by priority level. So only about 1% of cases were categorized as the highest priority of immediate jeopardy, while 91% were either low or medium priority. Page 15 discusses the backlog of cases, which is estimated to be resolved in 2 years, with 2 contracts awarded for nurse surveyors to conduct overdue complaint surveys. The contracts total $5.6 million and are primarily funded with $3.9 million in general funds and $1.5 million in special funds. Since the agency's fiscal 2025 and 2026 budgets include less than $600,000 in special funds, DLS has asked that the agency clarify the source of the special funds. The contracts provide for about 5 to 13 nurse surveyors per week for a total contract of $5.6 million. Considering that the total cost of salaries for 72 state employee nurse surveyor positions is $6.8 million, the agency should comment on the cost effectiveness of the subcontractors. And then the last key observation that begins at the bottom of page 15 provides an update on the final federal rule on staffing requirements in nursing homes. Exhibit 11 on page 17 summarizes the new staffing requirements and the timeline that facilities have for implementation. So the agency will monitor facilities for compliance during annual surveys. And I'll end my presentation with DLS's recommendation, which is to concur with the governor's allowance.
And thank you, Ms. Martinez. Seeing no questions from the body, if we can have Mr. Deputy Secretary and his team. Please, Senator Adelman.
Thank you. Since there's been a delay in the Family and Medical Leave Act, and it's almost $30 million here, what happens with that? Can you tell us a little bit about that?
Could you repeat that?
The implementation of the Family and Medical Leave Act, it was just announced at the end of last week that that is going to be delayed.
Oh, God. I don't know off the top of my head, but I can provide an update on that.
That'd be great. Thank you.
All right.
Yes, sir.
Thank you. Thank you, Chair McCray and members of the committee. For the record, I'm Dr. Nilesh Kalyanaraman, the Deputy Secretary for Public Health at the Maryland Department of Health. And I want to thank Ms. Martinez for her partnership on this and many other issues. I'm going to turn it over to Tia Witherspoon, our new Executive Director for the Office of Healthcare Quality, to actually go through our remarks and analysis.
Thank you. So good afternoon, Chair McCray and Budget Subcommittee members. It's my pleasure to be here today. I'd also like to thank Victoria for the detailed analysis and extend my gratitude to the dedicated staff at OHCQ, whose hard work is vital in protecting the health and safety of Marylanders. As the healthcare industry continues to expand rapidly, OHCQ remains committed to adapting and ensuring that Marylanders can trust their healthcare facility. Currently, OHCQ regulates over 22,000 providers in 47 different industries, and that's a 5.5% growth from 2023 to 2024. Some of OHCQ's notable highlights this past year includes accelerating the survey activity in our long-term care unit. In fiscal year 2025, the annual full survey completion rate increased by 160%. And in the first 7 months of this fiscal year, we've already completed 77 annual surveys. In addition, we've increased the rate of completed investigations for complaints by 72% and have cleared over 5,000 in the first 7 months of fiscal year 2025. We've also recruited and filled 12 new long-term care nurse surveyor positions, and this will help us to eliminate that backlog faster. The average interval time between surveys decreased by 21% in fiscal year 2025, and this means, again, that we're able to clear that backlog faster, and we do anticipate significant improvement in our times over the next few months. The use of nurse subcontractors has been vital in our work. It provides immediate ability to conduct survey activities on day one and has been critical in decreasing the backlog. Since at least 2019, every nurse surveyor hired by OHCQ has not had the necessary certification to survey immediately and has had to go through CMS's 12-month training to get certified. And as those 12 surveyors added in fiscal year 2025 go through training and become certified, they'll be able to tackle that backlog and eventually eliminate our need for the contract surveyors. So I'll stop here to see if you have any questions that we can answer for you.
Did you want to ask that question of the agency, Senator Adam? Okay, no problem at all. Seeing no further questions, colleagues, we do have one public witness. Mr. Deputy Secretary, it's Peter Cariccio.
Thank you.
I don't see him, so I do want to say just thank you in reference from the agency standpoint and the work that you all do. And thank you, Ms. Martinez, but you will not be going too far. So colleagues, we'll move to the second agency readout, which will be MDH Health Professional Boards and Commissions.
Thank you, Mr. Chair. My name is Victoria Martinez, and I'll be presenting the Health Professional Boards and Commissions analysis. The health boards and commissions work to certify and license health professionals and to resolve customer complaints. The fiscal 2026 allowance, as you can see on the first page, increases by $6.2 million or 13.4% for a total of $53 million. The majority of the budget is funded through special funds generated through licensing fees. Exhibit 1 on page 3 shows a breakdown of the agency spending for fiscal 2026, most of which supports employees and contract expenditures. Exhibit 2 on page 4 shows the breakdown of the $6.2 million increase. There is an increase of $6 million budgeted in miscellaneous personnel adjustments. MDH clarified that this was included in error and that there is no planned use of that appropriation. So DLS recommends reducing this allowance to correct this technical error. Other than that, the biggest changes relate to the sunset of the legislation that transferred Board of Nursing infrastructure operation to the MDH Office of the Secretary. These functions were budgeted as general funds in MDH and reimbursable funds in the Board of Nursing. Since infrastructure operations returned to the board in fiscal 2026, several changes reflected the decrease in reimbursable funds and the increase in special funds to cover these costs. On page 6 begins the discussion of the Budget Reconciliation and Financing Acts. The BRFA includes 9 board fund balance transfers to replace general fund spending under the Behavioral Health Administration. Exhibit 3 on page 7 shows the special fund balance transfers of each of these boards and the balance as a percentage of their allowance. After the BRFA transfers, some of the boards are left with a much higher balance as a percentage of their allowance. And because of this, DLS recommends amending the BRFA provision to authorize additional transfers from the boards that had a balance as a percentage of their allowance higher than 50%. So the rows that are highlighted in green in this exhibit reflect the DLS recommended modifications to the BRFA. DLS also recommends eliminating the proposed transfer from the Board of Optometry so that they aren't left with a negative fund balance after the proposed BRFA transfer. Moving on to personnel, on page 8, there's an increase of 3 regular positions, which are all contractual conversions in the Board of Nursing. Exhibit 4 on page 9 shows the vacant positions by board. The vacancy rate is 12%, which is about the same as last year. The first key observation on page 10 discusses the board's status in meeting their investigation goals relating to issuing new and renewal licenses and completing complaint investigations. Exhibit 5 on page 11 shows the number of boards that have missed each of these MFR goals, and Exhibit 6 on the next page shows the boards that missed these goals and the percentage by which it was missed. There has generally been improvement in the number of boards that met the goals in fiscal 2024. The second key observation that begins on page 12 is on the missed complaint investigation goals. Exhibit 7 on page 13 shows the board's performance with a bold text indicating that a board missed the goal. 6 boards missed this goal in fiscal 2024. but this is an improvement from 12 boards in fiscal 2020. The Board of Dental Examiners and the Board of Professional Counselors and Therapists missed this goal and have not passed 50% timely completion in the past 5 fiscal years. And the Board of Pharmacy showed improvement in timely completion from 42% in 2023 to 93% in 2024. The Board of Nursing had the lowest timely completion rate of 12% in fiscal 2024, but this reflects backlogged cases that were resolved through administrative closure. Exhibit 8 on page 15 shows the completed and outstanding investigations and the percent that was completed in a timely manner in the Board of Nursing. So the big increase in investigations in fiscal 2024 include cases prior to fiscal 2020 that were reviewed and administratively closed. The last key observation provides an update on the Board of Nursing infrastructure operations transferred to MDH. Legislation transferred these functions to MDH for 2 years, beginning in fiscal 2020, and so this is set to return to the board in fiscal 2026. There is a departmental bill that would extend MDH's oversight for an additional 5 years, and DLS has asked MDH to comment on why these functions would continue to be supported with general funds. There were 2 evaluations of the board that were conducted in 2023, one by a consulting firm and another by OPEGA. Exhibit 9 on page 17 provides an update on the status of implementing the recommendations, showing that 7 of the 16 have already been resolved and the rest are in progress. One of the recommendations was to study the board's fee structure to address budgetary constraints. And so Exhibit 10 shows the proposed fee structure and estimated revenue by fee category. So with that, I'll end my presentation and I'm happy to take any questions.
Seeing no questions at the time, if we can have, it looks like Madam Chief of Staff is the agency representative. No?
Thank you, Mr. Chairman, members of the committee. For the record, my name is Erin McMullen. I'm Chief of Staff at the Maryland Department of Health. With me at the table today is Amelie Brandenburg, the department CFO, and then Ms. Rhonda Scott, the Executive Director of the Board of Nursing. There's also members in the audience from other health occupations boards that are here today if you have specific questions. And I'd also like to thank Ms. Martinez for her analysis today. As you know, there's 20 health occupation boards at MDH, the majority of which are special funded based on licensure fees. With the exception of the Board of Nursing, the health occupation boards of the department are largely statutorily independent and function pretty autonomously. Before we respond to Ms. Martinez's prompts, I just wanted to take a moment to highlight some of the work that's happened over the past 2 years through the partnership with the Board of Nursing. 2 years ago, the board's infrastructure and operations were moved under the department as a result of a sunset extension, and that extension is coming to an end. The partnership between the board and the department is incredibly strong under Rhonda's leadership at the board. We've made noticeable strides in a number of areas spanning information technology, application processing, staffing, and then constituent services. As DLS noted in their analysis, we do still have some work ahead of us as it relates to resolving all the outstanding findings from the independent evaluations. And there is legislation to extend the Secretary's authority over the board's infrastructure and operations for another 5-year period. We do believe that that 5 years is needed to fully resolve outstanding findings, but also to migrate the board to a new licensure system. It's really our hope that this system can really be a model for the other health occupation boards that work there at the department. And with that, I'll jump to our responses. So concerning the DLS recommendation to reduce the fiscal 26 appropriation for the board by $6 million to correct a technical area, we concur with DLS and would recommend the legislature take that cut to reduce the board's special fund appropriation. The next prompt relates to several fund balance transfers that are being recommended by DLS for several boards. You have the written responses for the boards with you, and I believe some of them are here today and would like to speak to those transfers themselves. And then regarding the ongoing need for general funds at the Board of Nursing and whether increased fees are necessary if general fund support will continue. The existing legislative requirement regarding infrastructure support ends in the current fiscal year, and the 26 governor's allowance didn't anticipate sunset legislation would continue to fund the Board of Nursing infrastructure using general funds. So there are no additional general funds in the 26 allowance. If the board's sunset legislation does pass as introduced, additional general fund support would be needed to support the infrastructure budget. And I do just want to emphasize whether or not additional general funds are made available, the board's fee increases are desperately needed. They haven't been raised since 2007. There's a very thoughtful fee proposal that includes a phase in through fiscal year 29. It starts with registered nurses and LPNs, but I'm happy to provide more information on that if you have questions. And thank you, for your time and attention. That concludes our formal remarks. As I said, there are some other members of the boards here, I think one of which would like to testify.
Any questions? One question, just to be able to give the agency the opportunity to speak to it. A number of the boards wrote testimony about the transfer. If you just wanted to weigh in or comment in reference to the agency's thoughts behind the transfer.
Sure. I think it's my understanding that the fund balance transfers attempt to leave the boards with a appropriate fund balance so that no one would be operating in the red. As I mentioned, the boards are all statutorily independent and have their own written testimony, but I think from our perspective, leaving the boards with an appropriate balance, given the general fund shortfall, we understand why additional fund balance transfers might be needed.
I just also want to say, Madam Director, I got the opportunity to meet you during the interim. Obviously, you had a large role. It looked like the ship is steering in the right direction, so wanted to lean in and say thank you. One of the things that we talked about was just the technology and the infrastructure piece of it. Could you just weigh in on the communication? I wanted to make sure like the historical partners weren't left out. I think that I left the conversation comfortable that they weren't, but if you wanted to just comment on that piece of it, that would be helpful.
Sure, and you're
good.
Thank you, Mr. Chair, appreciate it. So as far as communication about the upgrades that we're making to the technology, sure, we're working with the department on the major IT development project, and we're working on establishing an actual workflow for the project. And as far as communication goes, as with stakeholders, I have regular meeting with stakeholders, and the plan is to engage stakeholders once the project is up and running, and also look at possible testing for stakeholders as well.
Got it, and thank you.
You're welcome.
I wanted to say from a public witness standpoint, it looked like, said 2 public witnesses, but the first one that we called, Madam Chief of Staff, we called him on the last one. I'll say his name again, Peter Caraccio. I think it might have been by mistake that he signed up for our respective committees. But the second one is Michael Patty.
I think Ms. Smith-Williams with the Acupuncture Board was hoping to provide.
Okay, no, let her come up
testimony.
first, please.
Thank you.
Yes, ma'am. Is there anybody else that we're leaving out from the boards? Okay.
Good afternoon. Chairman McCray and the subcommittee. I am Tiffany Smith-Williams. I'm the Executive Director from the Board of Acupuncture. Start by thanking Ms. Martinez for her evaluation. Reviews from the outside, looking at the operations, give us a platform to work for as far as stability of the operation and improvement going forward. So we appreciate that. You do have that I submitted to the committee. I just wanted to emphasize some of the points that I expressed in the letter. If I can bring your attention to Exhibit 3 in the report. Out of the 18 boards that are mentioned here that have fund balance transfers, there are 5 whom the fund balance transfer would leave them below the recommended MDH recommendation of 20 to 30%. In particular, the Board of Acupuncture would be left with a fund balance of 5%. It's concerning for me because the Board of Acupuncture is a smaller board, and though we strive to be fiscally responsible, the funds that we have sitting there, while we understand the need to support the operations and we are not in objection to the fund balance, we would like to be left with a balance that would give the board more operational stability going forward, which would be at the 20 to 30% level. And we did give a figure suggestion there. And I'm quite sure the other boards that are below 20% would like the same consideration. However, we want to emphasize that we do support the Secretary and the Governor's responsibility and appreciate the decisions they have to make, the hard decisions to make sure that all of MDH works well. My second point, while I have your attention, if I can draw your attention to the concerns expressed on page 22 about the IT operations. We look forward to working with the Secretary in acquiring a new licensing management system. I just had some concerns I want to express on behalf of the boards about, I think, that the last statement that said that the project progress was stalled in 2020, fiscal 2021, and it mentions in part because the boards could not come to an agreement. In fiscal 2020-21, the boards were in the midst of trying to recover from the cyber intrusion as well as working through pandemic operations. So at that time, their focus was not as much on trying to acquire a new system as it was to make sure that they did not stop issuing the licenses during that time. In 2024, an RFP was submitted and we deferred to the Secretary's actions. So that RFP has been put on hold to see what the Secretary's project will come up with, but I just wanted to make that clear to the subcommittee as well. And I realize that I'm over my time. I appreciate the opportunity, but I can answer any questions if the subcommittee has any.
Looks like no questions, but one comment. We didn't have you in reference to the oral testimony, and I tried to quickly look through from a written testimony. So if you could provide our staff the written testimony to be able to better understand the 20-30%, the stuff that you said orally, that would help. Colleagues, at this time, we'll move on to the public witnesses. We'll ask Mr. Michael Patty, who I say.
Great, thank you, Mr. Chairman. Michael Patty here today for the Maryland Occupational Therapy Association. Just wanted to highlight some concerns we had specifically to page 7 and 8 of the analysis with DLS recommending another fund transfer from the Board of Occupational Therapy to the Behavioral Health Administration. You know, last year we viewed this transfer as detrimental to the interests of occupational therapists, and we're back here again this year. You know, we believe the board should maintain their fund balance. OTs provide an essential service that assists individuals in overcoming a number of challenges in a number of different practice settings. And by maintaining the fund balance, we can ensure that the resources are available to appropriately regulate and advance the profession. Specifically about what's on the board's radar is, you know, they're moving forward with adopting new IT infrastructure to implement the occupational therapy compact. And then last year we said it, and we'll say it again this year, you know, whenever there is a fund transfer, you know, we're always concerned that that could lead to an increase in licensure fees. There are some other unique parts of the, specifically to the Board of Occupational Therapy in statute about where the funds go and what's their purpose. And, you know, we understand how challenging the budget is this year, but we just, you know, we'd hope that the committee would give us more consideration to not moving forward with this fund transfer. Thank you.
Thank you. Seeing no questions for Mr. Patty. Colleagues, at this time, we want to thank all of our boards for the work that they did. Thank Madam Chief of Staff, but also you, Ms. Victoria Martinez, in reference to the readout and the analysis. Thank you for your diligent work. Colleagues, at this time, we're going to move to our third agency report out, which would be MDH administration. And we're going to ask Ms. Naomi Camaro to give the readout.
Thank you, Mr. Chair. My name is Naomi Camaro. I'm a budget analyst with the Department of Legislative Services, and I'll be presenting the fiscal 26 budget for Department of Health Administration, which includes the administrative and operational offices of the Department of Health, including funding for major IT projects and funding for the 12 inpatient state facilities. On page 4 begins discussion of a couple different performance metrics that the Department of Health submits data on annually. The first is related to resident and staff safety at the inpatient facilities. The department has a goal of having no more than 1 assault per 1,000 patient bed days at each facility. And as you can see from Exhibit 1 on page 5, 8 out of the 10 facilities did not meet this goal in fiscal 2024. And over this time period, at the RICA Baltimore facility, the rate of patient on staff assaults increased most dramatically by 175%. The MFR submission also includes data on patient injury rate at the state psychiatric facilities, which is shown in Exhibit 2 on page 6. A second performance metric covered in this analysis relates to the average placement time for court-ordered patients. The Department of Health is required to place individuals that are found incompetent to stand trial or not criminally responsible for a crime in an appropriate inpatient facility within 10 days. On page 7, Exhibit 3 shows the rate and number of patients that are placed within that required 10-day period. In fiscal 22 and 23, the department was unable to place any patients within that time frame. And they've cited as the main challenge is that the bed capacity is currently limited and insufficient to meet the need of the number of court orders that they receive. Currently, the state's 5 psychiatric facilities operate at a capacity of 95% or more, and there's also a lack of appropriate beds to discharge people to in the state. On page 8, there's a list of bullets that summarize some of the efforts MDH has undertaken aimed at supporting people's transition out of these facilities and into appropriate care. Finally, the last point on the managing for assaults data is DLS identified several errors in the data when undergoing this analysis, and so we've asked MDH and the Department of Budget and Management to comment on the process by which they populate and submit the MFR performance measures and how both agencies will ensure accurate data reporting in the future. Page 9 and 10 summarizes some of the budgetary actions impacting the fiscal 25 budget. I'll point out toward the bottom of page 9, there was a cost containment measure authorized by the Board of Public Works in July 2024, which reduced general funds by $2.5 million in the current fiscal year to delay hiring of positions at the Thomas B. Finan Center, which is related to a delayed opening of new units. There's also a proposed fiscal 25 negative deficiency that would withdraw $6.8 million in staffing, also related to the delayed opening of these units. On page 10, there's a summary of the proposed fiscal 25 deficiencies that are included with the fiscal 25 allowance, resulting in a net $13.3 million increase to the general fund appropriation in this budget. The largest of this is listed right at the top. It's $9.8 million related to an emergency contract to temporarily replace the HVAC system at Perkins, which are no longer working. The department is working to implement a more permanent solution, and that discussion will be included in the Department of Health capital analysis. Exhibit 4 on page 11 breaks out the fiscal 26 spending for the Department of Health. A majority of the budget is allocated toward personnel at the state hospital facilities. And Exhibit 5 on page 12 shows the administrative and operational spending for the department. About 40% is allocated to operations, and nearly a third of the budget is for opioid response grants, including funding from the Opioid Restitution Fund. Page 13 and 14 summarizes the major changes in the budget between fiscal 25 and fiscal 26. So the entire budget grows by about $30.9 million. That's driven by increased costs for staffing, as well as nearly $30 million in provider reimbursements to comply with the Family Act. This funding will later be realigned to BHA, DDA, and Medicaid budgets. On page 15, there's data related to personnel. The fiscal 26 allowance includes over 4,600 positions under the administration budget. And as of December 31st, 2024, there were 657 vacancies for a vacancy rate of about 14.5%. A majority of these vacancies, 91% of them, are at the state-owned facilities. On page 16 begins discussion of the first issue in this analysis, which again relates to high vacancy rates and limited bed capacity at the state facilities, in particular Perkins. As I mentioned, all of the state psychiatric facilities are operating at a capacity at 95% capacity or more, which of course presents challenges for patient and staff safety, and the facility's ability to adequately care for patients. As of December 31st, 2024, the highest vacancy rates of the psychiatric facilities were at Perkins and Finan. Exhibit 7 shows the number of vacancies and the vacancy rate at each of the 5 adult psychiatric facilities and the 2 regional institutes for children and adolescents. So Perkins had the highest number of vacancies and the second highest vacancy rate just after Finan. Exhibit 8 on page 18 shows the number of positions at Perkins between fiscal 2011 and fiscal 2025, as well as the vacancy rate. These vacancy rates are included as a point-in-time count as of October 31st of each year. This rate has been increasing since 2020, and between 2024 and 2025 has nearly doubled. On page 18 and the top of page 19 summarizes some of the activities that MDH has undertaken to address the high vacancy rates, including hosting a career fair and implementing interviews on site for candidates. DLS is recommending adopting committee narrative, which would require the Department of Health to submit a report with information on bed capacity and patient length of stay at Perkins Hospital Center. The second issue included in this analysis has to do with the Center for Firearm Violence Prevention and Intervention, which was established by legislation in 2024. The center was originally established under the Prevention and Health Promotion Administration, but moved this fiscal year to the MDH administration. Exhibit 9 on page 20 shows firearm mortality rate in United States and Maryland compared to other high-income countries. And you can see that it's above the 90th percentile compared to other wealthy countries around the world. The fiscal 25 appropriation includes $2.4 million for the center in FIPA. And it's been spent on some of the items that are summarized on page 21, including hiring an executive director, a program analyst, or excuse me, a data analyst and a program manager, as well as undertaking some stakeholder engagement activities and setting up an inventory of existing violence prevention and intervention programs in the state. Fiscal 2026 includes $2 million for the program, and MDH has indicated that $1 million of this is for grants for organizations working on violence prevention. Pages 22 through 23 summarize some other efforts and initiatives that exist in the state, both at the local level and then with private institutions, including academia and hospitals. On page 24, there's just the final issue is quite brief, and it's summarizing the findings from a recent OLA audit that was released January 2025 related to MDH's documentation of federal revenue. DLS has asked MDH to comment on the steps that it plans to take to address these findings included in this latest closeout analysis. Finally, DLS recommends adopting narrative, requesting that report on bed capacity and patient length of stay at Perkins. And that concludes my presentation.
Thank you. And seeing no questions at this time, I'd like to bring up my secretary, Dr. Laura Herrera Scott, her team.
Good afternoon, Chair McCray, members of the committee. Laura Herrera Scott, for the record, Secretary of Health, and with me today is Amelie Brandenburg, our Chief Financial Officer. I want to thank our DLS analyst, Naomi Kimura, for her detailed analysis. And before I go into my comments, on a personal note, wanted to thank you, Senator McCray, for all your support of me. I like that you refer to me as your secretary, but just the whole committee and all the support you've provided to the Maryland Department of Health, so thank you. So the administration analysis covers a lot of ground, and I just wanted to take a few moments in the opening comments, at least just to focus some of my time on highlighting some of the complexities related to our state psychiatric facilities. As noted, over the past 4 fiscal years, there's been a significant increase in the number of court-ordered patients in the MDH facilities. We are at a juncture due to the number of court-order placements for our facilities exceeding our total bed capacity, resulting in a growing hospital wait list. In FY24, there were 995 court-order placements to our facilities, and we only had 1,056 beds, and that was across all our facilities and our adult psychiatric facilities. And they're operating at full capacity right now. And it's important to note that the court order placements are a mere fraction of the number of required evaluations. And last in 2024, there was more than 3,500 evaluations. So even if we cleared out all our beds, we still wouldn't be able to meet the demand that's coming in, especially as more mental health courts come online. I'd also like to discuss the progress underway at Clifton T. Perkins. DLS highlighted a number of initiatives that are underway at the facility across 4 areas: leadership, staffing, environmental issues, and availability of community placements. In the domain of leadership, we've made several key hires, and this week, Dr. Aaliyah Jones joins as the new CEO. I think you all recall she was the Deputy Secretary of the Behavioral Health Administration under the Hogan administration. She's a seasoned leader with a strong vision for the facility, which she has shared, and at some point we'll be meeting with all of you to talk about that a little bit more. We have also hired a new Chief Financial Officer and are actively recruiting for a Chief Operating Officer, so the whole leadership team will be new. As it relates to staffing, myself and other senior leaders of the department have spent significant time at the facility meeting with staff and executing new opportunities to address recruitment and retention, as well as staff training. The whole month of January, we had almost like a call schedule. It was a call schedule where leadership was in the facility every single day looking at different things, everything from clinical policies to clinical care to environmentally, the structure, brick and mortar, what was happening. So we had a whole team every day, put almost like an emergency operations center in place. And with that, we've taken lessons learned that we will be giving to Dr. Jones on Wednesday. In addition, we've taken, like I said, a hard look at our policies and processes related to incident reporting, especially those that relate to resident and staff safety. In September, we implemented a new policy because they were all treated equally. So an incident report could be a pipe burst, but it also could be an assault in the facility, and they were very hard to triage. And so, because I'm a physician and worked in an ER, we've built a triage system almost like an ER where 1 is urgent priority, personal, staff or resident safety, and then a 3 is, there was a pothole and someone broke their car and the pothole on the grounds. But we really tried to do that to start identifying the reports and the incidents that happen in the facility. And because we're doing a better job, the number of reports has gone up. Now, we still have a lot that we need to do to address those assaults, including staff training, adequacy of staff on the floor, but we are actively tracking that now in a way and then putting things in place to address what we're seeing in the incident reports. And hopefully this will provide greater transparency and faster identifications of incidents that result in staff or patient harm. And then lastly, the governor's budget makes investments in Perkins to address the environmental concerns. In FY25, nearly $10 million is included as a deficiency to supplement the appropriation of an emergency contract to temporarily replace the HVAC system at Perkins, which has been problematic since '23. The DLS analysis highlighted a number of other initiatives to help with the hospital throughput, which you'll hear a little bit more in the behavioral health budget hearing. And with that, I'll jump into our responses. Concerning the need to ensure accurate MFR reporting in the future, MDH recognizes the need for greater oversight of the performance data. We are realigning staff resources to the department's data office. I think you recall in 23 when we first got there, there was no formal data office, and there now is with a chief data officer. And they will be charged with secondary review of the MFR data prior to submission. And they will address any data anomalies at the program level before performance data is shared with DBM. So we hope this reconciliation will happen sooner. So when we come before you, the next secretary, the data will be more accurate than when you're getting today. Regarding the request for a report on bed capacity and length of stay at Perkins, we concur with DLS recommendations for the adoption of a committee narrative. The last DLS prompts asked us to comment on steps to address fiscal 2024 closeout findings. And we've given you a detailed analysis with some graphics who worked on it in partnership with our contractor Deloitte, but I just wanted to highlight a few things. For finding one, this is a similar finding that was noted in our prior 2 closeout audits, and we are working with our partners at Deloitte to reconcile the Schedule G. Currently, the team is working on DDA and the Medicaid clearing accounts, and we anticipate this finding to be resolved by close of fiscal year 25. Like I said, the graphic in our written response illustrates the Medicaid clearing account allocation process and why it is critical to analyze all balances when reporting any shortfalls or surplus. There is not a shortfall in the Medicaid reimbursements as of June 30th, 2024, but rather a $476 million surplus to be allocated out of the clearing accounts. Deloitte performed 20 Medicaid and DDA reconciliations between the payment management system, overall clearing account, MMIS, which is the Medicaid Management Information System, and the Financial Management Information System to confirm revenue received has been correctly allocated within FEMAS. These reconciliations required reviewing over 49 million transactions and covered 28 fiscal quarters. So clearly, we've gone way back in time to address the deficiencies. The other thing we've done under Amelie's leadership is worked with Deloitte to create 18 business process documents and 3 automated workbooks, which have aided with standardizing current business practices, as well as a reduction of repetitive tasks by 3 to 4 hours per week, enhancement of operational efficiency, and improvement of quality control. So what we learned in the OLA audit was that this was a breakdown of a single point of failure. And now with these SOPs and the efficiencies that were gained, regardless of who comes in the future, this should not happen again. And then concerning Findee 2, MDH reported general fund payables and other potential general fund liabilities totaling approximately $273 million as of June 30, 2024. Funding is provided in the fiscal year 2026 budget to address the disallowed DDA claims, and fiscal year 2025 deficiency funding is included in the governor's allowance to support unprovided Medicaid payments. OLA suggests a potential liability for unspent funds that must be spent by September 30th, 2025. However, the MFP demonstration grant was renewed until September 30th, 2027 by the Consolidated Appropriation Act of 2023, and MDH anticipates spending the enhanced funding before exceeding the deadline. And finally, we note that finding 7 from the fiscal year 2023 closeout audit, MDH did not properly report unrecoverable federal funds totaling up to $8.8 million to GAD was resolved. Thank you again. That concludes our formal response, and we are happy to take questions.
Senator Hettleman.
Thank you, Mr. Chairman, and thank you, Madam Secretary. We appreciate the update and the preface that you gave, especially with regard to Perkins. You mentioned the numbers of court-ordered placements and the evaluations that you must do. This is probably a tough question, but what is there in this budget to address those data points that you mentioned and the mismatch between the courts who are sending you people and the ability to provide services? And I'll I can't remember if it was here or in another setting, and you had mentioned some frustrations with the court system, and I'm just wondering if that has changed at all.
My frustration, no. The system is broken. I will say with Chair Clippinger in the judiciary, he has been helping to lead the charge. In 2023, several of us went down to Miami to see the Miami model, and Chair Clippinger was one of the people, including Chief Justice Fader, Chief Justice Morrissey, Chairwoman Pena-Melnick. So I think there's movement now in everyone looking at their piece, the judiciary looking at their piece, the public defenders looking at their piece, certainly the policing looking at their piece. So even when you think about the number of cases that we get in the pipeline, we have several that are misdemeanors with people that are timing out in 90 days and then get on our wait list. And yet we have outpatient intensive services that those people could be accessing if we could divert them away from the arrest in the first place. And I will just tell you, some of those cases are as simple as stealing a Mountain Dew from a 7-Eleven, although they had stolen something multiple times. But if we could get them into care treatment, get them into care sooner, then we would avoid the whole policing part. We have 2 jurisdictions that drive a lot of the arrests in general, one of them of which Montgomery County has stepped up, and we were in active partnership with them on how to do police diversion and getting people into treatment. So we have that going. We have the expansion of our crisis work. So we have now fixed crisis brick and mortar centers, but we also have expanded mobile crisis teams. So that's an opportunity for jail diversion as well. And like I said, there are discussions underway with the judiciary, who's willing to partner with us on the work that they do and thinking about the cases a little bit differently. We've been sharing more of the details of the case, especially for misdemeanors and non-sexual, non-violent criminal charges. And is there another way to manage those patients other than just committing them to one of our facilities? And then on the back end, the places where we discharge to, during COVID, many of those places shut down, and we are actively trying to address the needs of those facilities to see if we can increase capacity there. So there's a lot of work. A lot of people are coming to the table. Took a little time, but people are coming to the table to help solve what is a very complex problem. And I just want to say this complex problem is not unique to Maryland. It's nationally so.
So I appreciate that, and I'm glad at least that there were some efforts to move things forward. What was the second jurisdiction after Montgomery County?
It's Baltimore County. We haven't had as much success with them yet. But Montgomery County
I'd like to follow up with that conversation.
But Montgomery County has, with their chief administrative officer, they're working with the police. They've brought money to the table. We brought matching dollars to them. So we're actively working on a plan for helping to decrease the number of arrests coming into the pipeline.
Okay, I'll follow up with you on that. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Hedelman. Senator Zucker.
Thank you very much. Good to see you, Madam Secretary. The subcommittee needs your help with something. So we had, I guess it was on Friday, Mr. Chairman, we had Department of Human Services in. And in particular, we were talking about child fatalities and abuse within the foster care system. And we had asked them, with the great leadership of the Department of Legislative Services, for a report in terms of state child facility review. And with the chair's questioning, we realized that it was the last time that report was updated. And they disagreed with our analysis to get the report. They said it was duplicative. So with the chair pushing, he asked, when was the report last updated? And the department said 2019. We said, why aren't you updating? And they said, well, this is something that needs to be in collaboration with the Department of Health. So, Mr. Chairman, if I may, any help you can give Madam Secretary in terms of just reaching out to Department of Human Services. Mr. Chair, we can also urge the Department of Human Services to reach out to the Department of Health, but I think this is for the welfare of our children who are our children with the state of Maryland. So I just wanted to flag that for you, Madam Secretary, and just let you know that.
Sure, we can reach out to them. They have not reached out about a report or needs for any data, but we can certainly follow up with them.
And that's why I'm kind of flagging it now, just to put them on notice. I know that there are legislators, and I know the subcommittee is pushing back to restrict money from the Department of Human Services for the fact that they would not get this report updated. So we just want to make sure that we're doing what we can to protect the children in the state of Maryland.
Sure.
And just to elaborate, it's the Maryland Child Fatality Review Team. So they work under you all SHOP MDH. And when you go to the website, it hasn't been updated since 2019 in reference to these numbers. I think that we all agree, and I'm pretty sure you agree, just in reference to child deaths, like there's a hard stop there that we need to be making sure that this information gets not just to the legislature, but also to the public from that standpoint.
Sure.
Seeing no more questions, I got one comment, Madam Secretary. I got two folks in the crowd today before we get to the public testimony. One of them is Riley Dove. Riley Dove is interning in my office, and one of the spaces that she wants to enter into is health, so public health. So I just love, because we got one more agency after you, I don't want to leave and just make sure that Riley introduces herself. But also I have a young lady, Ethna Meisner. She's actually a high school student over at Baltimore City College. And while she's not dealing with health, you will be surprised. She has big dreams in reference that she wants to be a Supreme Court justice. So I also want to make sure that she introduces herself to you before you all leave out of this space. Colleagues, we do have one public testimony, and that is Ms. Jenny Reese.
Good afternoon. My name is Jenny Reese. I'm the proud president of ASME Local 539 and the Maryland Department of Health Unit Vice President of ASME Council 3. This past year, I have had the opportunity to visit several of our MDH facilities. To say this experience has been eye-opening would be an understatement. From the Eastern Shore to Western Maryland, staffing is a major concern, and the lack of resources for our clients alarming. At Clifton T. Perkins, patients participate in less than an hour and a half of therapeutic activity a day. We do not have enough social workers, rehab, and other services to provide them with the resources they need throughout their hospitalization to better assist them to return to the community. Due to these shortages, we continue to see assaults, both patient to patient and patient to staff. Without being engaged in therapy, there is little for patients to do other than think about and execute plans to exchange contraband and get into altercations. Security and nursing are short as well. There isn't enough security for every unit. Units that should have at least 4 nursing staff for over 25 patients have been operating with only 2. Employees are not being relieved for their meal breaks, resulting in one recently passing out because their blood sugar was so low and 911 had to be called. Our court-involved hospitals are suffering from the shortages as well. This is unacceptable and a complete disregard to safety. The current budget proposes a $6.8 million cut, initially to fund Finan Center and make beds available, to relieve MDH from the continuous scrutiny for the wait list of incarcerated individuals awaiting admission for psychiatric evaluation and treatment. We are the Maryland Department of Health. We need to do better. I went into this profession to provide quality patient care for those suffering from mental illness. Without staff and adequate resources, we are simply unable to strive to our full potential. Please pursue alternatives to cuts to state services. Thank you.
Thank you, Ms. Reese. Seeing no questions, I do just want to think that I say it on behalf of the entire committee. Just thank you for your leadership and what you all are doing. AFSCME, all the workers across the state of Maryland in reference to the health profession. So just thank you.
Thank you, Mr. Chair.
Madam Secretary, always good to see you. And Ms. Camaro, just thank you for the readout and just the education that you provide to all of us. Colleagues, we're on our last agency readout at this time, and that will be the Department of Housing and Community Development, and that will be from Mr. Scott Benson. Aaron, can you make sure they introduce themselves?
Good afternoon, Mr. Chairman. My name is Scott Benson, and I will be presenting the operating analysis for the Department of Housing and Community Development. The mission of the Department of Housing and Community Development, or DHCD, is to work with partners to finance housing opportunities and revitalize great places for Maryland citizens to live, to work, and to prosper. The department's programs are administered through 3 operating divisions. The Division of Development Finance, which includes the Community Development Administration, the Division of Neighborhood Revitalization, and the Division of Credit Assurance. As you can see in the operating budget summary on page 1, the fiscal 2026 budget increases $42 million, or 8.1%, to $558.6 million. To note, special funds increased by $24.7 million in the fiscal 2026 allowance, or 18.8% compared to fiscal 2025. So DHCD uses both budgeted and non-budgeted funds to address Maryland's housing needs. You can see in Exhibit 1 on page 5 the sources and uses of DHCD's funding in fiscal 2024. So approximately 74% of DHCD's funding in fiscal 2024 came from non-budgeted revenue bonds, securities, or tax credits, while DHCD's budgeted federal and state funds accounted for 15% and 11% respectively of the department's total funding. DHCD's funding from all sources totaled $2.6 billion in fiscal 24, with homeownership and special needs housing overtaking rental housing development as the largest component of DHCD's expenditures in fiscal 2024, accounting for 40% of expenditures. Moving on to the performance analysis. On page 6 in Exhibit 2, you can see the homeless individuals in Maryland. Between January 2023 to January 2024, Maryland's count of homeless individuals increased by 3% to 6,059, compared to an 18% increase nationally. Overall, this measure of Maryland's homelessness levels declined by 28% between calendar 2015 and 2024, while homelessness increased nationally by 37%. On page 7 in Exhibit 3, you can see the Homelessness Solutions Program funding by purpose. The Homelessness Solutions Program, or HSP, fiscal 2026 allowance included $19.1 million in general funds, which was a decrease of $500,000 compared to what was appropriated in fiscal 2025. As of January 2025, HSP has allocated $18.3 million in fiscal 2025 to homeless services. As you can see in Exhibit 4 on page 8, HSP has provided assistance to 9,985 people in fiscal 2024 who were homeless or at risk of becoming homeless. This is a 3% decrease compared to the 10,312 people who were assisted in fiscal 2023. Additionally, the number of people exiting homelessness to permanent housing similarly decreased by approximately 4.6% between fiscal 2023 and 2024. Moving on to failure to pay rent, evictions, and foreclosures. You can see in Exhibit 5 on page 9 the number of failure to pay rent cases as well as the number of evictions. Evictions began to decrease in the fourth quarter of 2023 and continued into the first quarter of 2024, but have since remained relatively stable from that point, hovering around 3,900. On page 10 in Exhibit 6, you can see the number of notices of intents as well as the notices of foreclosure filed within Maryland with the Office of the Commissioner of Financial Regulation. Both measures increased sharply following the end of protections in June 2021, but they've generally remained below pre-pandemic levels until the end of calendar 2024. This is when NOIs increased above 20,000. In the fourth quarter of calendar 2024, NOIs totaled 21,057, which was 15% higher than the fourth quarter of calendar 2019. Now, Despite this increase in NOIs, NOFs, or notices of foreclosure, decreased by 40% between the first quarter of calendar 2023 and the fourth calendar of 2024. Moving on to the implementation of legislative priorities. The Section 21 of the fiscal 2025 budget bill added a total of $14.1 million in general funds to DHCD's operating budgets. This is in addition to actions approved by BPW to delete $250,000 from these additions. And on page 12 in Exhibit 7, you can see the legislative additions made in fiscal 2025, with the largest being for emergency rental assistance, which was a total of $5 million. Moving on to page 13, Exhibit 8, you can see the fiscal 2025 deficiencies. In total, DHCD received $2.9 million in deficiencies in their fiscal 2025 appropriation, with the largest going to the Division of Development Finance, which was a total of $1.3 million. Moving on to the fiscal 2026 overview. The fiscal 2026 allowance totals $558.7 million, and you can see in Exhibit 9 on page 14 that the rental services program accounts for the majority of the planned spending, or 61% of the overall allowance. The second largest share belongs to energy programs, which consists of $85.6 million of the allowance, or 15%. Moving on to the proposed budget change. You can see on page 15 in Exhibit 10 the proposed budget and as well as the changes in the fiscal 2026 allowance. The fiscal 26 allowance increases by $42 million, and this is primarily due to an increase in energy programs such as Empower Maryland and rental programs such as the statewide voucher assistance program. For energy programs overall, funding for energy assistance programs in the operating budget has increased by $19.6 million, or 29.7%, after accounting for deficiencies to a total of $85.6 million in the fiscal 2026 allowance. This increase is primarily driven by the increase in the Empower Maryland program. In fiscal 2026, Empower Maryland will have a significant expansion in program activity to meet the goals set out in Public Utilities Article 7224. This has required DHCD to implement policies that reduce greenhouse gas emissions 0.9% below baseline and introduce standards for who can be approved as a contractor. Partially offsetting this increase in energy programs is a decrease of $6 million in reimbursable funds from DHS to the Low-Income Home Energy Assistance Program. Moving on to rental assistance. The fiscal 2026 allowance includes $10 million in rental subsidies for the statewide rental assistance voucher program, as mandated by Chapter 446 of 2023. This is an increase of $2.5 million from the fiscal 2025 working appropriation, although DHCD received the mandated $10 million in fiscal 2025. Cost containment actions approved by BPW in July 2024 have reduced the funding for the program by $2.5 million due to startup delays. Now, the largest increase in the rental assistance program occurs for the Section 8 program, including both increases in federal funds for vouchers of $5.5 million and administration of $25 million. Regarding the Infrastructure Investment and Jobs Act, DHCD has been awarded $45.7 million in federal funds from the IIJA for the Weatherization Assistance Program, or WAP. The fiscal 2026 allowance for this program through IIJA decreases by $113,648, or 2%, to $5.5 million when compared to the fiscal 25 working appropriation. This funding is in addition to regular funds for the WAP. Moving on to personnel data. As you can see on page 18, the number of regular positions increases by 1. And as of December 31st, 2024, DHCD has 26 vacant positions, of which 12 have been vacant for less than 3 months, and 2 have been vacant for more than a year. Contractual full-time equivalent positions decreased by 12 in the fiscal 2026 allowance compared to fiscal 2025. This net change results from decreases in a variety of programs, including the Rental Services Program, the Office of the Secretary, and the Housing Development Program. Moving on to issues. The first issue to discuss is broadband. And recently, Chapter 74 had renamed the Office of Rural Broadband in DHCD to OSB and expanded its responsibilities to include a statewide broadband plan, collecting and publishing data on broadband availability and speed, as well as furthering digital inclusion efforts. You can see in Exhibit 11 on page 19, the funding from all sources appropriated for the broadband program across DHCD's operating and capital budgets through the fiscal 2026 allowance. This totals to $710.7 million. In DHCD's operating budget, the fiscal 2026 allowance includes $3.2 million of total funds, including $2.4 million in federal funds, primarily to support contractual services, and $782,000 in general funds for contractual full-time equivalent positions and grants. Several broadband programs are continuing into fiscal 2026 and are expected to continue until December 2026, when all their funds need to be expended. Exhibit 12 shows the funding awarded or encumbered as of January 2025, and some of the programs include Maryland Emergency Broadband Benefit, Connected Devices, the Maryland Emergency Education Relief, Connected Communities, and Digital Inclusion. Also to note, the Affordable Connectivity Program has ended. This program ended as of June 1st, 2024. It was a federally funded program through the Federal Communications Commission, under which eligible households within Maryland were able to receive $30 per month for broadband. And with that, we move on to the recommended action, and DLS recommends reducing the fiscal 2026 allowance by 1 position due to the current 26 vacancies that could be reclassified. And that concludes the presentation. I'm happy to take your questions.
Thank you. Seeing no questions from Mr. Benson, at this time, I'd like to call up Secretary Day.
Chair McCray, Senator Zucker, Senator Hedelman, good to be with you. For the record, my name is Jake Day, Secretary of the Maryland Department of Housing and Community Development. To my left is our CFO, Sergey Kuzminchuk, and to my right is Deputy Secretary Julia Glanz, and we've got a big team behind us. We've got folks from various divisions within the agency who, if you're okay with it, will pull up to help answer questions when we get to that portion of our discussion today. Proud to be here with you to talk about DHCD's 2026 operating budget as proposed. As Governor Moore stated last week, Maryland is facing down 2 simultaneous storms that have arrived on our shores. Number one, COVID funding from the federal government papered over a major inherited structural deficit. And number two, the stark new policy direction of the Trump administration and an unpredictable Congress with the potential to implement policies that could hurt Maryland's economy is very real. And we're prepared to talk about some of the implications should we want to get into that today. The Moore-Miller administration has introduced a common sense budget that is guided by our commitment to weathering both of those storms, but also to growing our economy. In partnership, DHCD has been hard at work trying to make Maryland more affordable, and our budget reflects that fiscally responsible approach. I want to express my gratitude for Scott Benson and DLS for their diligent work and thorough and fair budget analysis. And I'd like to provide just a few brief notes in response to the recommendation and observations. In response to DLS's recommendation to delete the new position for financial manager and fill it by reclassifying a vacant position, the department respectfully disagrees. The increase in one permanent position was the result of a statutory mandate in House Bill 538. That was the Housing Expansion and Affordability Act of 2024 to create a historic property revitalization director within DHCD and provide a salary for the director in the state budget. General funds is the only funding source available to cover the cost of this position, as the position is not related directly or inherently to our Division of Development Finance or the Community Development Administration operations. All other vacant positions are earmarked for specific DHCD operating needs with their corresponding funding sources, or in some cases, multiple funding sources. If the General Assembly doesn't provide general funds for that position, DHCD will not be able to identify alternative funds in this coming fiscal year for this statutory mandate other than those general funds as suggested. Responses on other requests from the analysis were provided in my written testimony, but I am happy to, as I said, get into a conversation with you about any questions you have or any of the external factors shaping and influencing our budget and housing in Maryland today.
Senator Hettleman.
Chairman, thanks, Mr. Secretary. I would be remiss if I did not ask for an update on where we are with the provision of eviction prevention funds via the community schools. And I see Danielle back there smiling at me.
We'll have
I'd have expected this, right?
While I start to answer, we'll have Danielle make her way to the table, if that's okay with you, Senator.
Yeah, and I did see, you know, that was one of the issues that was raised, and I saw your response to it, and I would just, May seems like a long time away. So if we could get a little update on progress, that would be great.
Absolutely. I think the key takeaway here is recognizing that, you know, this program and the funds associated with it, I think taps into a fundamental connection between kids who present ultimately as unhoused or having housing instability in a setting where there's a responsibility to acknowledge those situations and produce a meaningful response. So the framework, the concept is great. The implementation and the need to identify the right partners and the parameters around the expectations of those partners is what's taking a little time. That and the geographic identification of the conditions. So there's, as Danielle can talk about, there's a lot of variables that go into that determination, and we're working through the data now.
Sure. I think, you know, we're taking a slightly different approach to this program than we would just a general homeless prevention because of the community schools connection. So we are working with MSDE as well as the Governor's Office for Children as part of the broader work they're doing in community schools to try and align strategy before we release the RFP. And our progress in planning did get stalled a little bit because we wanted to make sure that there are going to be ongoing funds for this program because that has implications for the RFP and grantee selection process. So now that we know the governor's proposed allowance has those funds continued for next fiscal year, we're looking at putting out an RFP in the next couple of weeks that would allocate both the $5 million for this year as well as the $5 million for 26, with the contingency that it has to be fully approved through the budgeting process, obviously. But we have been working on a data-driven formula for how to target those funds. You know, $5 million, $10 million even over the course of 2 years sounds like a lot. But when it all shakes out, it's about 1,200 to 1,300 families we can serve a year. So we do have to decide which jurisdictions will be targeted and prioritized for those. And that's what we've been working on. So within the next couple of weeks, you should see the RFP itself come out. And then we'll be working to select grantees across the state for that.
Thank you. I'd just like to follow up and say it is even more important given the decrease in general eviction prevention funds, which is a shame. And it's needed, as we can see from the report and out in our communities. So, you know, it just bumps it up that much higher in terms of priorities. So, thank you.
Thank you, Senator. I should have noted for the record that was Assistant Secretary of Homeless Solutions, Danielle Meister. I know you know.
We all know Mr. Meister.
I know you do.
I hope that's a good thing.
I just assume, I assume that's got to be put on the record somehow.
Senator Zucker.
Thank you very much, Mr. Chair. Mr. Secretary, I didn't know if you could have your members of your team stand up, just so we can take a look at them?
Absolutely, absolutely. All right, Team DHCD, on your feet.
So Mr. Chairman, the reason why I thought this was important is I know, and thank you so much. The reason why I've never done this before, Mr. Chairman, but it seems like our federal employees are under attack, and I wanted to make note that today is actually a state holiday. So the fact that we have state employees working so hard, even though it's their time off, I wanted to make sure that, and I know we had talked about this earlier, that the subcommittee recognized that. So thank you for all your hard work.
Senator, thank you. If I can just add, you know, I wouldn't even have to ask. Like, this team is passionate about what they do every day. And, you know, I think many of us forgot that it was a state holiday today. But thanks for the reminder.
So agreed, and I think that's where some of the what's lost in terms of the translation, in terms of both our state and federal employees work hard. And, you know, of course it's lost that it's a state or federal holiday because we're working for the people of Maryland and the country. So, but in a world where very rarely do people get thanked, I think it's important to double down on it during these chaotic times.
Amen.
And usually I would lean in, but I think it was said so eloquently that I don't need to say much, and I see a number of familiar faces that I know that are working diligently. Secretary Day, just thank you team for this perspective. There'll be a number of folks coming to talk about how great this analysis is after you. I encourage you to stay, and at this time, you want a second bite at the apple?
I do. I'm going to thank Senator Zucker, and also just say that the work that you do is all the more important given this big green blob on your charts here and how much money comes from the federal government that passes through your agency. And, you know, we're all sort of on pins and needles here, not knowing what is happening at the federal level. And so it just bumps up the importance of what you do every day, because these money go to the community and at the most basic level. So thank you, and just want to echo, I'll lean in if the chairman passes. Thank you.
Mr. Chair, if you don't mind me just taking a quick second, then I know you got a full day, but a quick second just to say, you know, we're seeing real time the effects. You know, we've got agencies that are the recipients of some of those pass-through dollars that are talking about layoffs, stopping providing services. Just this past week, there is a $10 million federal loan that was being counted on at the closing table. And it was one of those frozen funds. And it meant that 200 families will not see their townhomes in affordable, you know, income-restricted townhomes, will not see their townhomes renovated as a result. So there are real consequences, and they're happening right now, thanks to frozen funds and the effect of politics on what are real meaningful programs that shape people's lives and their experiences every day. So thank you for recognizing the hard work that the team does. You know, these are people that care very much about Maryland citizens and their housing. So thank you.
And thank you. Mr. Secretary, at this time, we'll move on to a number of folks that'll give public testimony. I'm going to call he might have made a mistake, but I'm going to call his name because this might have been the one that he was trying to get to. Peter Caruccio? No. And if you all can come up in fours. Matt Hill, Stephanie Prostel, Claudia Wilson-Randall, and Heather Sheridan.
Good afternoon, Mr. Chair. My name is Matt Hill. I'm an attorney at the Public Justice Center, which is a part of Renters United Maryland. And Renters United Maryland strongly urges the committee to restore $5 million back to DHC's budget for eviction prevention funds. Eviction prevention funds, also known as emergency rental assistance, pay 1 to 3 months of back due rent to ensure that a short-term crisis, such as a job loss or reduced hours or a medical bill or even car theft, does not become a catalyst for homelessness. And so just to review, the General Assembly last year added $10 million to the budget for eviction prevention funds, $5 million to the new community schools-based program sponsored by Senator Hedelman, and then $5 million for less restricted eviction prevention funds. The proposed budget maintains the $5 million for community schools program, but not for the $5 million for less restricted eviction prevention funds. And while this cut may result in a short-term budget gain, it will be a long-term fiscal loss. We know this because in 2024, we had an independent study commissioned, found that at roughly $10 million would assist 3,747 families who are most at risk of homelessness in avoiding eviction, and that every dollar spent by the state returns $2.39 in fiscal gains to the state. And that's because avoiding homelessness saves the state money. There's less need for state-funded emergency shelter costs, less being spent on Medicaid, and for homeless folks who have to use the emergency room as their primary care doctor, more stability for kids in schools, and frankly, a better outcome for those of us working in rent court and eviction prevention services. Because when we're able to access eviction prevention funds for our client, we can oftentimes make a deal with the landlord to say, look, fix the roof, and then my client can stay in the home and you can get paid through the eviction prevention funds program. So it's a good leverage of the state's investment in right to counsel on evictions. Thank you for your time.
Good afternoon. My name is Stephanie Prestel, and I'm the Executive Director of Housing Initiative Partnership, HIP for short. We're a nonprofit affordable housing developer and counseling agency based in Prince George's and Montgomery counties. We have served thousands of residents through our housing counseling work, as well as developed single-family homeownership and rental housing. And I'm here to support DHCD's efforts and its operating budget. We utilize one of the programs that we utilize a lot is through the community revitalization programs, and that's NED, the National Capital Economic, I never get the name right, NED for short. And it is for revitalization efforts. And we really appreciate the level funding that we're seeing this year. But I'm going to encourage you to think about operating dollars that go with those capital dollars. I know we are in very tight budget times, but one of the challenges we as nonprofits have is also paying staff and being able to pay our bills to operate efficiently and effectively these programs. You'll see I provided some pretty pictures in my testimony of some of the great work we've been able to do in partnership with Maryland DHCD. We are developing affordable home ownership. We have done housing counseling work. We have gone off after vacant, legally complicated housing that we've been able to shake loose. And we've done a lot of work to provide affordable, effective home ownership for our community. So we really encourage you to think about the support that we as nonprofits also need to implement these programs. Thank you.
Good afternoon. Claudia Wilson-Randall, Executive Director of the Community Development Network. I want to thank, as you recognized, everybody at the Department of Housing and Community Development for their outstanding work and their partnership with CDN members across the state, from Garrett County to the Washington metro area to Baltimore, Central Maryland, Western Maryland, Eastern Shore, Southern Maryland. We have members all over working hard to invest in their community and to work to improve people and place at the same time. And the funds in all of the programs are a vital match to private investment. And so today, you have my written testimony, but I did want to just make a couple of points that my colleagues have already made, that we need operating support to go with our capital commitments. So if there's $27 million in Bernie, we need $2.7 million in operating capital to go along with that, really to move the capital. Without operating funds, our members simply cannot move the capital dollars. With NED, which is the National Capital Strategic Economic Development Fund, thank you, There's $12 million in the capital budget for that, and we would need $1.2 million, about 10%, to move those capital dollars. So I did put my CDN's budget recommendations in with my written testimony, but I did want to make that point. And I would also echo the need for eviction prevention funds. One point that I just want to make about eviction prevention is that we have people across the state who have a car emergency. Their car breaks down, their car is stolen, and they can't get to work. And so every day in this state, people are making the choice between having their car fixed and going to work. And we can do better than that on a one-time emergency. So thank you very much. And I just want to, again, recognize the great, outstanding work that the Department of Housing and Community Development does.
Thank you. Good afternoon, Mr. Chair and members of the committee. My name is Heather Sheridan, and I'm the Chief of Homeless Services with Baltimore County. I'm here today in support of Senate Bill 319 and the operating budget for Maryland DHCD. Please maintain this funding to the Homeless Solutions Program. Baltimore County DHCD awards just under $5 million annually in federal, state, and county funding to 13 different service providers, maintaining 25 distinct homeless serving programs in our county each year. State HSP funds represents about a quarter of what we award to our partners and serves as critical match and gap funding for what federal funding does not support, such as emergency sheltering, street outreach, and homeless prevention services. Over the last 2 fiscal years, the HSP funding awarded to Baltimore County has allowed Baltimore County to provide services and housing placement assistance to 531 individuals living on the streets of our county throughout the year. We've placed 91 households into permanent housing and provided services to support them in staying there. Also with HSP funding, we provided emergency sheltering to over 172 households, prevented homelessness and diverted 113 households from becoming homeless, and supported 122 households with short-term rental assistance, including 28 youth-headed households. I implore this body to maintain the Homeless Solutions Program funding allocated in the governor's proposed budgets. Cuts to these critical emergency programs will only lead to increased costs elsewhere in our county, such as in our state, such as additional burdens on hospital and emergency services, public service costs, and more expensive health impacts for anyone experiencing homelessness, which will further increase costs to our public health insurance programs. Fiscal efficiencies and overall system savings can be partially maintained if this crucial state funding remains at the current levels. I've submitted written testimony, and I thank you for your consideration.
Thank you very much. Is there any questions for the witnesses? Great. Thank you very much. Thank you. I'm just batting cleanup right now, so I play Corey McRae only in committee, not on TV. So let's call up Jennifer Mercer. We're going to call them up in fours. Lisa Sarro, Ernestine Simmons, and Kaylee Schmaltz. And start in whatever order you wish, please. Welcome.
Good afternoon, Jennifer Mercer, staff attorney at the Pro Bono Resource Center of Maryland. I represent low-income tenants facing eviction in Baltimore City and in Baltimore County. I'm here today to applaud the inclusion of the $5 million investment in the Eviction Prevention Funds and Community Schools program, and to ask that the $5 million in less restricted funds be renewed. This funding is a vital piece to the housing stability puzzle. An overarching goal of our program is to promote housing stability among low-income tenants. In recognition of that, in addition to our legal staff, we have an eviction prevention counselor whose job it is to assist clients outside of court. By far, the best tool in her toolbox is rental assistance. Last month, she worked with a single mother who had received a judgment in court for only $423.15 in past due rent. She wanted to stay in her home, but unfortunately, she could not locate rental assistance in time, and so she and her children had to move out. Under the current budget, while we may be able to access funds if people have students in a community school, thousands of Marylanders will not, those who are young adults, elderly, single, or families with children who do not attend a community school. Most of our clients want to stay in their homes and pay the rent that they owe. Many are working one or more jobs, but are still having to make difficult choices about which bills to pay first. Very often we meet clients who are in court because they had a temporary setback, a lost job, reduced hours of medical bill, or a family crisis. This setback caused them to miss 1 or 2 months' rent, which results in a seemingly endless cycle of compounding late fees, court costs, and the threat of eviction. Often they are able to pay rent going forward, but the threat of eviction still looms. Eviction prevention funds can stop this cycle. We know that every dollar the state spends on eviction prevention will save $2.39 in the long run. With a payment of a few months back rent, many tenants can achieve long-term stability. We are intimately aware of the thin line that separates housed families from those experiencing homelessness. We urge you to replace the $5 million in DHCD's budget to keep families on the right side of that line.
Good afternoon. Good afternoon, members of the subcommittee. My name is Lisa Sorrow. I'm Director of Advocacy and Litigation at Community Legal Services. Community Legal Services is a legal services provider in both Anne Arundel and Prince George's counties, and we do advocacy throughout the state. I'm here to urge, as my colleague did, the return of $5 million to the eviction prevention program within HSP. I've got 3 main points to discuss. First and foremost, any discussion about eviction prevention needs to bear in mind the demographic most likely to be evicted in our country. In October of 2023, Princeton and the United States Census came out with a new study which for the first time overlaid court records and census data. What they found was staggering. The demographic most likely to be evicted in our country is a household with children under 5. 0 to 4-year-old children are the most likely to be evicted in our country. The next demographic up is the next age group, 5 to 10. We can do better than that, and we can prevent many evictions. But to do that, we need to have the funding to do it through the great programs that the Department of Housing and Community Development administers through the Homeless Solutions Program. I'd also like to quickly point out, since I'm not going to get to all 3 of them, I want to point out quickly that our state's overall eviction rate is being kept artificially low by Anne Arundel County and Prince George's County, 2 of the only counties in the state that still are running eviction prevention programs post-COVID. So when that money runs out, we are going to see a spike in the overall evictions in the state. And for that reason, I urge you to add that $5 million back into the HSP budget for DHCD. Thank you.
Good afternoon. My name is Ernestina Simmons, and I serve as the Director for the Mayor's Office of Homeless Services. I must say I'm very cognizant of this time, so I'm going to read off of my paper. I'm appreciative of the opportunity to provide testimony in support of DHCD's budget. This funding has been instrumental to the City of Baltimore as we serve our very vulnerable population, but I also want to highlight the partnership with DHCD has also been instrumental in how we've been serving clients for the City of Baltimore. Since 2019, Baltimore has seen a decrease in homelessness by 30%, according to the most recent point-in-time data. The point-in-time data represents a snapshot that we are making strides in the right direction, but we must also acknowledge our reality, which is in federal fiscal year 2024, we serve 7,989 clients in our emergency shelters and through our street outreach teams. As a city, we have been able to make significant investments by utilizing ARPA dollars to invest in long-term housing solutions. These investments have been in partnership with DHCD State, Baltimore City DHC, the Housing Authority of Baltimore City. Some of the projects I want to highlight is the conversion of 2 hotels that we intend to create 100 permanent supportive housing units with a vision of on-site medical services. And the second one is in partnership with Baltimore City DHCD. We was able to launch a housing accelerator fund, which ultimately is going to land 132 permanent supportive housing units for the city, as well as 494 affordable housing units. What I want to lift up is that we all understand that housing is the solution to ending homelessness, but we must also understand that we must strengthen clients' ability to access services, which is what HSP dollars allows the city of Baltimore to do. Without these funding, we would lose shelter services to our transitional age youth. Our drop-in centers would be impacted, and 18 community-based providers would be impacted. So thank you.
Thank you, Chair McCray, members of the subcommittee. My name is Callie Shumitz. I'm Vice President for External Relations with the Maryland Center on Economic Policy. I am here to join with the other folks you've heard from today in support of restoring the $5 million for general eviction prevention funds. When it comes to housing spending, I think Maryland has long prioritized investments in affordable housing creation. While this is an important long-term strategy, it does not help people who need assistance staying in their homes today. And these strategies for long-term housing creation and providing immediate assistance really need to go hand in hand. So we definitely recognize the challenges of the budget situation this year, but we think that cutting this already very limited funding for eviction prevention is short-sighted. As other panelists have said, this $5 million could help hundreds, possibly thousands of families stay stably housed. And in the long term, that means the state will spend a lot less, if these families are evicted, in the long term, the state will spend a lot more addressing the needs of these families through emergency shelter, through expanded need for income supports, for disruption in work or school that have long-term effects on that family, or I think there's a deep connection to the need for foster care for families who are unstably housed, and we know that is an expense that is going up in the state as well. And just a nod to the conversation earlier about the concern about what's happening at the federal level. Maryland certainly can't fully replace what the federal government does, but every little bit that we can do at the state level could really help protect families against what is happening with federal cuts. So we would ask the subcommittee to do what you can to restore the funds to at least match the funding for eviction prevention available in the current year's budget. Thank you.
Thank you. I'm gonna hold my comments until we have everybody there, but I just can't say enough. Thank you for that level of advocacy that you're doing. Ms. Juanita Howard, Ms. Sarah Price, Amanda Rodriguez. Coming around there. And Deidre Robertson.
Good afternoon, Mr. Chair, members of the committee. My name is Amanda Rodriguez. I'm here on behalf of Turnaround. We're a victim service provider in the greater Baltimore region focused on supporting survivors of intimate partner violence, sexual violence, and human trafficking. We're urging you to restore full funding for the eviction prevention and emergency rental assistance. The need for assistance is only growing. At Turnaround in FY25, spending on eviction prevention increased by 48% comparable to previous years. This increase reflects the stark reality that more of our most vulnerable Marylanders, those fleeing power-based violence, are struggling to stay housed. Because individuals are staying longer in shelters and emergency housing, demand for services is higher than ever. This fiscal year, looking at quarter one and quarter two, we're showing an increase of over 20% between last year and this year. We serve hundreds of families, providing thousands of bed nights to our community's most vulnerable families. These numbers tell a clear story that more people need help, not less. Eviction is not just a housing issue. It destabilizes families, disrupts employment, and pulls children out of schools. This drives survivors back to abusive households with significant risk for increased violence. Eviction prevention is a smart investment by reducing pressure on emergency shelters, healthcare systems, and social services. We simply cannot afford to cut these critical funds. Instead, we ask for you to restore level funding to where it was last year to ensure that Maryland families have the support they need to stay in their homes. Thank you for your time and your commitment to keeping Maryland's families safe.
Good afternoon, Mr. Chair and honorable committee members. Sarah Price here on behalf of the Maryland Retailers Alliance to emphasize the importance of maintaining the level funding for the Main Street Improvement Program. This is a $1 million line item grant under the Neighborhood Revitalization budget for DHCD, which provides funding for 34 officially designated main streets, 9 affiliate main streets, and then 9 additional Baltimore City main streets. This funding can be used in a variety of ways for the main streets, between supporting their staffing levels, providing professional development and training for staff, beautification and cleanup efforts, events expansion, DEI programming, historic facade improvements, and some have even leveraged their state funding as matching dollars to get federal funding in the past when that has been available. We ask that you please maintain the $1 million that was set in this year's fund because the Main Street program at this time is able to provide equal dollar amounts to each Main Street, but with the number of Main Streets in the program, it's effectively been maxed out. If the dollar amount decreases or if the Main Street number increases, then we need to look at some reallocation. But this is very meaningful funding for particularly a lot of these smaller main streets in the state, and continuing to fund these historic commercial epicenters. It directly supports the governor's goals of trying to grow Maryland's economy and ease the operational environments for small businesses. My written testimony includes several statements from main streets around the state, and I would direct you now to Deirdre from Frostburg.
Good afternoon, and thank you for this opportunity to speak with you today. My name is Deirdre Robertson, and I'm the Executive Director for Frostburg First, and we are one of those 34 affiliated designated Main Street programs for Maryland. We're located in Western Maryland, home to Frostburg State University. We're also a trail town on the Great Allegheny Passage. And I just want to talk a little bit about the impact of this Main Street Improvement Program funding. We've come, especially over the past 2 years, to really rely on this operational assistance. As a nonprofit organization, operational assistance is extremely difficult to come by, and this assistance helps us complete our strategic planning goals. It helps us to provide training to our board, our volunteers, and our staff, and then it also makes it possible for us to implement projects that benefit our communities. Main Street programs are community assets. By investing in this Main Street Improvement program, you're able to invest in economic development, historic preservation, and the overall benefits for housing, and redevelopment in our historic main streets and urban areas as well. Just in the past year, we've been able to utilize the funding to leverage federal funding to support development planning, technical assistance. We were able to purchase and install 11 security cameras in our downtown, providing safety for our businesses. And we were also able to do a feasibility report on one of our vacant historic buildings that's essentially a white elephant on our main street and is an issue for bringing in new development. By doing this, we're going to be able to provide information on redevelopment for that building, rehabilitation, and additional housing opportunities and new businesses. So I would ask you to please maintain that level of support. We do rely on it significantly. Thank you.
And thank you. Colleagues, that is all of the public testimony, but I do want to make sure that someone that may have thought they signed up but didn't sign up drove all the way to Annapolis because it was 19, so this is very out of the normal what we're asking, but just making sure there's nobody in there that wanted to speak and didn't get the opportunity to speak. Okay, now we'll give comments. So as I heard the testimony, listened to the testimony, I just wanted to lean in and say thank you. And I say thank you because when the public sector or when I find myself in situations that I can't deal with myself, it's a number of you all that gave testimony just now that step in and help me get through my challenges for my community. So, you know who you are, Matt Hill, Callie, Ms. Claudia. It's a number of you all that's doing the work and just can't say thank you enough. And what you were expressing today is how much DHCD is that partner to help you all feel and do your job. So we say thank you. On behalf of the entire subcommittee, Secretary Day, I think you got enough praise, man. I think you got a lot of praise. But also, Mr. Benson, you don't frequent HHS, but it was good to have you here, and just thank you for giving us an accurate readout so we can see the picture a little bit more better. Colleagues, this ends our hearings for HHS today, and look forward to seeing you all later this week.